Welcome, Christine, Lene, and Sophie. So glad to have you on the call. So I know that we're a minute past the top of the hour. I think we could get started. Again, welcome everyone for joining. Thank you for joining today's call. Good afternoon or good morning, depending on where you're calling in from today. Our coalition conversation today will be spotlighting one of the 9 action plans we launched last week. And in today's webinar, we'll be hearing from the individuals who wrote and worked closely with the action plan, addressing residents' goals, priorities, and preferences. So as I mentioned, one of the strengths of our coalition is how diverse it is, and we really encourage you to introduce yourself in the chat if you haven't done so yet, so we can all see who's on the call today. And I also want to ground us a little bit in today's topic, which is the action plan addressing residents' goals, priorities, and preferences. So in the chat, when you introduce yourself, do feel free to share what it means to you, or what does it mean to you that a resident's goals, priorities, and preferences are addressed. Why is it important? And I'm hoping we can go through the chat together later on and see what others have said. And before we jump in, we want to thank the John H. Hartford Foundation for generously funding the Moving Forward Coalition. This work could not happen without them. So in terms of our time together, my colleague and chair of the coalition, Alice Bonner, will be sharing a little bit more about the coalition and what an action plan is. And then we'll be passing it off to the individuals who've led and worked closely with this action plan, Mary Luciolfi, Tara McMullen, and Terrence O'Malley, to share about their action plan addressing residents' goals, priorities, and preferences. And then we'll have some time for Q&A for questions. So do hold on to your questions or chat them in as we go. We'll be keeping track of them. And then we'll be wrapping up with ways you can stay connected to the coalition and the action plan going forward. And I know many of us here are coalition members who've joined today. So if at any point you have anything to add to what is being said, please don't hesitate to let us know in the chat or by raising your hand. So now I will pass it off to Alice to share a little bit about our coalition. Alice?
Fabulous. Well, I'm busy chatting in because we've got such an exciting array of people on this call today, which is absolutely wonderful. You know, we have nursing home owners, providers, advocates, nursing home residents. Thank you so much for being on. Some of you we've had on these calls each time we have a coalition conversation. So wherever you're from and whoever you are, we are glad you're here. This is an organization, as you know, so some of you have seen these slides before, but you know, we're just a group of organizations and individuals who come together to make sure that the NASM report from 2022 that has 600 pages of recommendations about nursing home quality is turned into action plans, and that we really take action now in terms of what we can do with nursing home quality and especially quality of life for residents. So one of our primary issues all throughout this last year has been to hear the voice of nursing home residents. And I see, you know, Frank and Cindy and Nancy and other people on this call who are living in nursing homes. So we're so grateful that you're on with us. Next slide, please. So when we started, we didn't have a vision and a mission, and this was developed with all of you, with people in the public. And our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. They want to work there. And we're working on that. That's very much focus of 2 of our action plans that you'll hear about in another coalition conversation that we're going to have within the coming weeks and months. And then our mission, or how we're going to get there, is that we're going to make vital changes in policy and practice through the power of bringing diverse voices together now. And our steering committee is the one that said, we need to have the word now in there because we want people to know this is really happening as we speak. And we're starting, you know, we started July 1st. That was the beginning of year 2. Next slide. So, you know, we have to ask, okay, so what is an action plan? An action plan, and you may have, if you were on last week, you know, we had a nice series of slides that Sumeri put together for us that kind of walked us through each of the action plans, what's on the first page, the purpose section, the timelines, etc. So when you look at the action plans, and hopefully you had a chance to look at this one that we're talking about today, it's a series of steps, step-by-step guide to what we need to do on the interim basis with tasks that would get us to the deliverables and the goals that we set for ourselves at the end of the initiative. Next slide. So I already referenced the NASEM report. This is what it looks like. You can download it from the website for free. You don't want to print it at 600 pages, but you can read it on your laptop. Next slide. And when we started, a lot of you were involved in this. There were some priority recommendations that were based on a template that looks like this. And from that, we then had priorities that we posted on the website for a while. We just took them down. We actually moved them to another section because now we posted the action plans, which are the versions of these priorities that the committees worked on. Next slide. So again, we had those 4 value statements on the previous slide, that across the committees, the focus remained on collaboration, sustainability, equity, and feasibility. And then these are pictures of our co-chairs and work group leaders who were talking about in these work groups, the research and the partnerships and the collaboration among committees. And you're going to hear a lot about that today because this particular action plan has a lot of cross-committee collaboration in a good way. And they talked about what matters. Why are we doing this? What's really going to come from it that's going to move the needle forward? Next slide. So we're not talking about all 9 action plans today. You're going to hear us focus on just one of them, but this is just a reminder to say, please go back to the website, look at the 9 action plans, read them, share them, send them to people, ask people what they think. These are they're meant to be working documents. So we want to know if we can make it better. We want to know if something doesn't come across clearly, etc. So thank you to Mary, who is of course chatting in both the NASEM report and the link to the action plans. And next slide. And with that, I'm going to hand it over to Mary Lou Chalfie, who's going to start us today with digging into this particular action plan on goals, priorities, and preferences. So over to you, Mary Lou.
Thank you, Alice, and hello, everybody. It's so great to be here. I have to say, it is very exciting to be kicking off the public presentation of the coalition action plans. I just want to say too, they really are the coalition of the culmination of so many months of really thoughtful, insightful discussions and conversation among a really diverse group. So it's impossible for any plan to reflect the full depth and breadth of those conversations, but trust me, those conversations have been had and are still ongoing. And we look forward to more conversations with all of you in the months ahead. So as you can see from the NASEM quote on this slide, one of the key recommendations of the report was to, quote, operationalize person-centered care that reflects resident preferences, unquote. So that has been truly our North Star as we have developed the material for this action plan. So the action plan addressing resident preferences is an integrated plan, as Alice alluded to. It's integrated among goal committees 1, 6, and 7. And the reason for that is that we found that there was some overlap among those committees' work as it related to person-centered care planning, which is, of course, the vehicle that we use to learn about, document, and deliver person-centered care to residents. Next slide, please. This is a concise statement in the action plan about the goal of the action plan, but the key elements are the ones I've highlighted in yellow here. So we have to develop things. We have to develop a goals, preferences, and priorities collection tool. We have to develop a care planning process. We have to create a measure that aligns the delivery of care with the actual care plan that's documented. We have to work with all of you, right? With residents, with families, with providers, policymakers, advocates, other interested parties. We have to make sure that whatever we create and develop can be integrated into current systems, because otherwise, what's the point? It's not going to work. And then finally, we have to pilot it. We'll do some small pilots, learn about effectiveness, and hopefully grow those pilots in the future. Next slide, please. So the purpose and intent of the action plans really is we want to make sure we accomplish that goal and all its component parts in a way that truly is inclusive of all of you, very transparent, and keeps us fully accountable to ourselves as coalition members, but certainly to all of you. So when we provide maybe some periodic updates in the upcoming year, we'll be open about where were the challenges, how much progress did we make, where didn't we make progress, and why. Next slide, please. So each action plan has some proposed timelines. Actually, and this is a part of our timeline for this particular action plan, and it depicts milestones really, and of course the target completion date. But you'll know that we are currently working on and will continue to work on really far more detailed work plans that represent discrete parts of achieving these milestones in a timely way. So since this is an integrated action plan among the three committees, these milestones represent work that each committee will do. So I'm going to talk about the three care planning ones that are related to care planning, then maybe Tara or Terry, if you want to address the milestones for the other committees. So for our part, the care planning subcommittee of Goal 1, we've identified three really important milestones. The first one is we need to complete a couple of key reviews of the scientific literature. First, on what are the goals, preferences, and priority assessment tools that are out there, and what is the language? What does goals, preferences, and priorities really mean? What's the language we're going to use to define those terms? And is that language that's even relevant for residents and families, staff, and leadership? That's number one. Number two, we need to obtain input on whatever we develop from all of you. Feedback, input of any type will help us accomplish these goals and create successful tools. And then three, we really need to develop a care planning process and embody it in a guidebook so that you all know what can help you strengthen care planning in the future. So that's going to be a guidebook, still working on the platform and the structure of that, and then a accompanying repository of tools. So before I keep going, I'm going to check in with Tara and Terry if there's anything you want to say now about the milestones for your committees.
Yes, thank you, Mary Lou. This has been a really nice informative background. And basically for the Quality Measure Committee, the intent is, basically everything Mary Lou teed up, is to see if the goals match the delivery of care, and how do we work to assess that? How can we evaluate that and create a measure that could be possibly publicly reporting what's going on a population and national level? It's a big ask. So much of our work, our major milestones, you'll see on the bottom of this table, and the milestones center around developing a measure. Goal concordant measure is the care concordant with the residents' goals. And so we will be committee 6 with committees 1 and 7. Our larger team will be developing a suite of measures, or assessing if we can find a really nice set of measures that we can pilot test on a larger scale to see if we can find a valid and a reliable approach to assessment. And within that assessment, if we can determine a good process for collecting that measure and the data in that measure, so the data can inform care outcomes. And also so that data can be exchanged bidirectionally. And that's where we run into our work with Committee 7 with Terry O'Malley. And I don't know, Terry, if you wanted to speak to any of the major milestones here in the table as well.
Sure, thanks. My apologies, my camera decided to go AWOL. So I think the real challenge for the three committees is coming to consensus on a list of goals, preferences, and priorities that really capture the most commonly referenced goals, preferences, and priorities as a place to start. So we need that in Committee 7 to figure out what the goals, preferences, and priorities collection tool is going to collect and how it's going to do that. So we're all in the game right now of coming to consensus on goals, preferences, and priorities that meet the needs of all three committees. And I think that's our biggest challenge. Once we get to that, then I think we all have our separate work plans that are pretty well defined, and we'll move on down the line. But thanks to Tara and Mary Lou for the lead in.
Thanks, Tara. Thank you, Terry. So I'll keep going here. Next slide, please. So I'm going to just give a little more explanation about how the action plan supports person-centered care planning, because truly that's where our focus has been for the past several months. Next slide, please. So in its own words, this integrated action plan is going to advance best practices and support for a care planning process that does collect, document, and truly reflect a resident's needs and wishes. And of course, since all providers are doing care planning as a regulatory requirement, the question we asked ourselves months and months ago was, okay, what can the coalition accomplish that really supports improved care planning processes to make them, one, more person-centered, right? More empowering, more inclusive of residents and families, and maybe even direct care staff. And more importantly, we want the care planning process to be successful in actually collecting, documenting, and delivering all aspects of care and services that a resident really wants. So that's essentially a quality improvement process, right? So we landed on a combination of quality improvement supports. One, the guidebook that I mentioned that tracks the care planning continuum and sort of comes back around, because care planning doesn't ever really end. A curated repository of tools, of resources that providers can draw on when you all decide what's important to you in strengthening your own care planning processes. And then three, as Tara mentioned, meaningful measures to track the extent to which a care that a resident actually gets is what's reflected in the plan. And then four, a tech-enabled platform for doing that, collecting, documenting, and measuring. Right. Next slide, please. So I've divided up this care planning process into four categories, if you will. So the first one really is about organizational self-assessment. So again, we're still trying to figure out where this guidebook is, how it's going to be structured, where it's going to live, but I can review some essential components. So for any quality improvement effort of any sort in any industry, right, we have to first assess what we want to do quality improvement on. So our one of our milestones is developing a care planning self-assessment tool that helps providers sort out, where are their own care planning strengths? Where are the weaknesses based on what we all agree should be a stronger, more person-centered care planning process? So that's part one. The pre-care planning work is really figuring out, okay, what is the way to get to a most successful care planning process internally? What do you need to know? What does everybody need to know in order to do a really good job? So we're starting to collect and curate, and in some instances, we're going to have to create some things. So these are trainings, materials on, I would say, foundational aspects of person-centeredness that contribute to successful care planning. And these are foundational topics that, one, have not been previously dealt with or trained in long-term care, or just haven't received a lot of attention. And these are things like true personhood. What does personhood really mean in an older adult transitioning into long-term care or remaining living in long-term care? Identity, ageism. How does internalized ageism impact the way that folks act living in nursing homes, or how staff and families and others interact with those older adults? Self-determination in older age, dignity of risk in older age, the extent of human potential. What does that mean? So we know these concepts are super important to human beings. We hear from residents and families that they're important to residents and families. What we don't know is whether they are consistently showing up in daily life, and if not, how can we get them to show up consistently in daily life? Because if we don't do that, we're never going to be really successful achieving the goals of meaningful person-centered care. So this pre-care planning domain also includes some orientation material for residents, for families, also for staff, because another thing that we've heard is that residents and families don't really understand care planning very well. They don't feel included. They don't always feel safe speaking up and saying what they really want. So an orientation guide would help move that along. In that third category, more effective care planning is really the heartbeat of care planning, assessing, collecting, documenting, delivering care and services, right? So we want to find the best assessment tools, the best supporting resources that do all of that in everyday life. And I would say in both formal and informal care planning processes, because honestly, a lot of what we, and I say we because I used to be a provider, a lot of what we hear about what a resident wants comes in informal conversations in daily life, as it should. So how can we translate that into something formal that gets delivered? And then finally, how is care, the care plan aligned with what is actually delivered for care every day? And that's the intersecting point with Tara and her work in Committee 6. And Tara's going to talk more about that. Next slide, please. So our vision is to take all of those 4 categories and put them into a guide that is structured for accessibility, is in a place that can be easily used, where providers have choice about what tools to use. And hopefully, this is our vision, we're going to get increased person-centeredness, greater inclusivity, greater subject matter knowledge on some of those hard to define topics, greater alignment with resident preferences, and greater empowerment. So with that, I think I'm handing things off to you, Tara.
Thank you, Mary Lou. And I wonder, Sumiri, if we want to focus on maybe 2 slides back that kind of show the process. That, yeah, it's such a good focal point. So thank you, everyone. This is so excited. I've been so excited to present all day, and Senator Moore and others who are in the chat, just really opening up this conversation, a much needed conversation that we should be having nationally. And thank you to Alice for spearheading this. And specifically, I want to thank Committee 6. I see a lot of the Committee 6 members here. We are the quality measurement group here for the Moving Forward Coalition. And on behalf of my colleagues, I want to present to you our idea, the next step. So building from Mary Lou's presentation, our committee was charged with the task of developing a measure for goal concordance, and simply just breaking that down is, once again, as I stated earlier, do the goals of residents' goals, a person's goals, their wants, their needs, does that match the delivery of care? Are they getting what they need at the time that they need it? And so where we begun this journey was an assessment of the National Academy's report. And basically, a lot of the members of our committee were motivated by the potential of a goal concordant measure to complement many of the efforts that were going on and are continuing in the field, such as efforts around the quality reporting program with the Centers for Medicare and Medicaid Services, efforts with the Veterans Health Administration, but efforts at the state level. And really all of this is being signaled, signaling that the residents' voice is central to activities to improve outcomes. All of this is being signaled now in policy. And we're starting to hear this more and more. So this is a grand opportunity for us to take an open door and to improve care plan processes and the reporting of that data. The reason we think this is so important is the collection of a resident's goals is essential to the aspect of improving clinical care, and as well as coupled with the improvements of administrative and operational outcomes. Because it enhances the conversation between the resident, the provider, and the staff, and it really brings the resident's voice forward as the principal element in the shared decision-making process. And we know, everyone on this call knows, that there's ample evidence that suggests that aligning the goals and the care of the resident, it represents an opportunity, but also will, and as we are purporting, we're going to pilot this, will reduce disparities in resident populations, will personalize those goals. This is what Peggy Williams said in the chat, that goals, it's a personal thing. And if we can figure out how to assess that, we can personalize this in the care plan. But more specifically, what our group is really aiming to do is to help uncover the bigger picture. When we put together the data from a person about who they are, what they want, their goals, their preferences, their priorities, we're really forming a more complete picture of that person. And when we form that more complete picture via data that we collect from a measure, which is a construct, it's the vehicle of that collection, we're really giving that individual a better chance of letting the provider know these are the pieces of my puzzle. And when we know those pieces, we can help improve outcomes. This is a better way of serving the resident. This is a better way of giving individual the care that they want in the manner that they choose. So again, we're developing a measure to help kind of develop this vehicle, this mechanism for collecting the data. And we're hoping that what that data will do is not only give the residents that voice, that we know that the voice needs to be there, it needs to be in the front of every discussion, but making sure that voice is at the front of every discussion. And then hopefully having a measure that can be collected at a national level that can be used in a payer program like Medicare, that will really say, this is what's going on in this facility. Here's how the residents' voices and their needs and their wants, this is how they're being acknowledged. This is how their agency is being, we're purporting and we're holding up their agency. This is how we take care of our residents. And then using that as hopefully in a mixture of other measures to support any future system like or payer system such as a value-based purchasing initiative. Also, we hope that that information will become an intricate part of the care delivery by supporting the interoperability of that data. And with that, and what I mean by interoperability is exchange of the data via electronic health record and making sure that the provider can use that data to inform their care delivery. So with that, I'm going to pass it over to my colleague, Terry O'Malley from the HIT committee, who will describe the efforts of Committee 7, picking up from Committee 6.
Hi, thanks, Tara. So what we're engaged with is not only trying to create the goals and preference priority collection tool, but then also to develop an HIT-enabled process that allows us to collect that data quickly and then to measure whether or not the care provided aligns with the individual's goals. So I imagine in the beginning, we'll be doing this measurement again as frequently as we can, but it may not be frequently enough to give facilities the ability to make real-time corrections in the care plan, to bring the care plan into alignment with the individual's goals and preferences. But our goal in the long run is to get a process that works rapidly so that facilities can actually make changes in the care plan when it's brought to their attention that the plan is not concordant, not in alignment with the individual's goals and preferences. So just as Mary Lou stated, we have a lot of development to do. There are no known processes out there that do this. So we're going to develop a process to collect the goals, and we're going to develop the process to measure the alignment. And then we're going to have to test it and refine it. And that's our work going forward. But we're going to rely on Committee 6, Tara's work group, to come up with the measures, and then within those measures, what data elements do they need to populate the measures and to allow the measures to produce outcomes and help the facilities improve their care. So I'll stop there. I don't think anyone really wants the details of how we're going to do this. That's the overview. So it will be a fun journey, and I can't imagine better people to be on it with. Thanks.
Well, that was a whirlwind of information, and for those of you who are following the chat, there's a lot of good conversation going on, particularly about nursing home residents expressing themselves, feeling comfortable, getting to a point where they feel comfortable expressing themselves, not being afraid of retribution. And there's a few people who, I just mentioned to them, to chime in here. Senator Moore, I don't know if you want to take yourself off mute and just say a few words about, why this is such an important issue. And I know it's one probably all of us on this call have been following for a long time, and we just have not made substantial progress on this, and we have to do better. So is there anything that you'd like to add to your chats there?
Well, the experience that I'm referring to is we've at Dignity Alliance, and I know other advocate groups have tried to get people who are residents of nursing homes to provide testimony at a legislative hearing. The legislators hear from the nursing home industry quite frequently, but they don't hear from the residents as much. And it's really the residents that we want to make sure are getting the right care. And right now, Massachusetts, and I'm sorry to say it, I know this is probably since you were Secretary of Elder Affairs, even in assisted living, their complaints are not being kept up. Part of it's a staffing issue, so, and maybe technology could address that to some degree. But when they don't hear on, they complain, but they're not even they're just in the queue. They're not even getting their complaint addressed. But secondly, even when they get it addressed, if there's not feedback to them to let them know what happened, why it couldn't be done, why it could be done, or what's going to be done, whatever. I think all of that, that kind of communication needs to be there in order to build up their confidence that when they do make a complaint at some risk, because they're afraid they'll be punished by the staff or the management or whatever, when they do make that complaint, they need the confidence that somebody's listening and actually trying to fix the problem, not necessarily that it gets fixed right away. But I think they need feedback. They need both when they make the complaint and then later on periodically as process gets implemented or their care plan gets changed. That's really the key. I think it's that kind of communication that would help to improve confidence that it's worth speaking up, not that you're definitely going to get punished for speaking up, or as oftentimes can happen and does happen. So I think those are the kind of things. And I mentioned in early in the chat, I came across because the legislature today and Committee on State Administration is hearing a bunch of bills on remote hearings, making that a standard as it was done during the COVID, which is still with us. But to try to make sure that people, I don't know how it is in some of the other states. In many cases, the state capitals are central to the state, but they're not always on public transportation or whatever. For an older adult or somebody with a disability to get to our state house in Boston, even if they're in the MBT district, which moves slowly these days, but even if they're in the district, they have to give up a day to go to a hearing if they can't do it remotely. If they do it remotely and they let people know they're on the line, in many cases, the legislative committee will get them to speak. But so it's important that a lot of stuff happen remotely. And I mentioned I came across it as preparing testimony for that hearing, the Internet Society, which I'd never heard of, but I'm sure it exists somewhere. But they had several, I think 6 suggestions for people who aren't always that acquainted with computers and digital interactions and things of that nature. I think the folks in the IT committee particularly need to take a look at that sort of thing. Because I don't consider myself to be all that computer literate, but I have a feeling that there are people in nursing homes that are even less computer literate than I, and that's pretty bad. It's making them comfortable, A, making the complaint, B, knowing how to work the equipment so they can make the complaint and not simply tell staff, but who oftentimes will, especially if they're temporary staff, will ignore them.
Right. Thank you so much. That was a great summary. I want to say that we don't always have someone who is a surveyor or even a former surveyor, but we have someone on the call today, Peggy Williams, who's been chatting in some wonderful information. And Peggy, I wonder if you want to also respond here, because you said, about care planning being so important and hearing the voice of and having it be centered around, the nursing home resident themselves. So is there anything from your experience with survey that you would say, there's some ways to sort of integrate some of these ideas about how to improve, what Senator Moore was just talking about?
I'd be glad to speak up. Over the years, there's been other tools that have come out. I know there was some committees that worked on a care planning document to try and individualize the care plan. I'm not sure that ever got released. I was with CMS at the time that committee met. There are certainly some other tools out there called care plans, people don't understand what that means. They think they can just change the word from resident to I, and it's a I care plan. It's not the same. I think that somehow we really just need to get CNAs empowered. And I know that in this time of staffing crisis and et cetera, it's a challenge to have CNAs do more than just provide the care. But that's where the root starts. The CNAs have to be engaged in a meaningful relationship with those residents and be empowered to actually provide the care according to that resident's routines. So many of the systems that are followed really are just driven by management, not by the residents. So there is a shift in mindset that has to occur. How we create tools to make that happen, I'm all for it. If we can figure out how to make it happen, I would be so excited. Conversation I keep having with providers when I go out on surveys.
Yep.
You know, let's see how we can make sure the CNAs know what the residents' goals and preferences and priorities are. They may have it on the care plan, but do the CNAs know what's on the care plan? They're
That's right.
20 to 25 pages long. How are they going to know? So
That's right. Right.
get rid of the technology that creates these standard care plans and make them write it on a Cardex.
Well, there you go. Well, that is fantastic input. I think a lot of people's heads are nodding here because those of us, I mean, I'm a nurse. We have a lot of nurses. We have a lot of social workers and advocates on this call. I think we all relate so much to what you just said, Peggy, and you know, having the opportunity and the way you're speaking to us now about let's do this together, let's figure this out, and let's make sure there's standard processes. And I know, you know, Mary Lou and Tara and Terry, who, you know, live and work in this space every day. You know, this really resonates with them. I know, Tara, you put your hand up, but before you speak, I just want to invite if either Frank or Nancy wants to say something here, because I know they're both chatting in. And Frank, you've been on so many of our committee calls and you have such a perspective. Is there anything else that you would want to share with the group?
I just wanted to respond to the senator pointing out that it takes real personal contact with people in nursing homes to get valid feedback. There needs to be an environment created of trust, because the potential for retribution is awful. And I've experienced it, and Nancy can document that in spades. It's a very, very, very big barrier. And many people in nursing homes don't respond well to a request to respond to something on a survey or online. So we need a cadre to do a sort of a random sample, perhaps, of nursing home residents who've not complained, not had anybody approach them, and have those people schooled a little bit in advance on how to create the relationship of trust and how to be able to warranty that it won't go any further individually, to really get at the nub of what the problem is.
I'm so glad to hear this conversation coalescing around the role of certified nursing assistants. I mean, this is not controversial at all among the members and participants in moving forward. We know this has to be a role that is enhanced, where there's career development, where it's, you know, they can have meaningful types of roles going forward, director of CNAs, educator, CNA educator, things like that. So we have a lot of good conversations, and we really do need to do more. So thank you to Frank. Nancy, I just want to see if you want to chime in at all. I know I know you've done a lot of work with Barb Bowers and others on the team, and we're definitely going to keep that moving forward, as we say. But Nancy, is there anything else you'd like to share with the group?
Well, I think one of the most important things is just piggybacking off of what Frank just said. Thanks for all of that, Frank. The trust issue, or the non-existence of trust, or the inability to build trust, relationships, things like that, especially after retribution has already happened. There must be forgiveness. Residents can't just continue to be told by ombudsmen and the Department of Health, they need to just think about moving facilities when something goes wrong. I forgave everyone that caused attrition to my life. And if anyone's interested in those details, I'm more than happy to share those with you, but there's no time for that right now. But even after that fact, there was so much fear that I would betray the administrator's trust or the director of nursing's trust. So that when surveyors would come, I was being told by my two CNAs that the administrator had his ear to my door while I was being interviewed by the surveyors. And then another example, just quickly, during the window visits for COVID, the administrator was standing directly behind the wall, smoking his cigarette, listening to everything that we said, my visitors and I would say. And so there was no one to talk to. They kept changing my phone number, my room line phone number, without telling me. Just a whole bunch of different examples, but yeah. So thanks for letting me share those things.
Thank you so much. And your voice is always appreciated, and we'll circle back to you. But Tara, you wanted to add something to the conversation. Go ahead.
Sorry, I couldn't get off mute. I was responding in the comments. The chat area is amazing. And I wanted to respond to Peggy and Peggy, I love the comment about having the CNA understand what's in the care plan. And I wanted to say that Committee 6 is following up with that. We are, and Senator Moore, I was responding to your comment, we are deploying soon surveys that would assess how the resident goals are managed, but does the staff know what are the goals? And it seems like such a simple question. Does the provider understand the goals of the resident, even through their rotations? How are the goals documented? But what we're finding is that it is such an inconsistent variable practice, and it's how do you have a good, reliable measure without a good process? So these are the things that we are unpacking, and Peggy would love to speak with you more about it. And Senator Moore, you did ask, have we looked at care plans? And the answer is yes, Committee 6 has. I don't know if other committees have, but we have such and Alice has spoken to this, such a wide array of experts, from the ombudsman to the surveyors who are representing their respective disciplines here on the committee. So we have that diverse input into our development, and and even working with Mary Lou in Committee 1. And what we're finding is that not only do these processes need to be bolstered, they need to be improved, they need to represent reality, but there's so much, again, variability that it kind of blows your mind a little bit. So I think that, when we move to developing a measure and a process and exchanging this data, it is going to be an enormous lift because of the nature of the process that's currently going on state by state, nationally, even within facilities, there's variability. I just wanted to add that. I just really respected Peggy's input, and I wanted to underpin that it was a great suggestion.
Yeah. It is great. And Frank, I don't know if you have your hand up again or if that's from before. You're good. Okay. I just wanted to say.
I wanted to say one thing more about CNAs.
Yes, sir.
One of my roles, I feel, in this organization is to bring hope. And I had an extraordinarily good experience in a nursing home twice. I'm a graduate of twice of a nursing home. And our experience in the greenhouse was that it was really possible to have the CNAs at all times understand what the care plan was. And it made an enormous difference. So it is possible.
That's great. Thank you for that. And, lots of positive ideas here. I know we have a couple of people who are on this call who are currently working with a QIO. So the QIO program, as many of you know, has done in many of their statements of work over the years. It's done a lot of work with care planning and processes around care planning. There's also other people on this call who have been as nursing faculty or other social work faculty, have done some of this work in their research. So I just invite anybody else to speak up about what they've done around care planning and any ideas that they have to contribute here. Any best practices? I know Sora Levy put in something about a DON who actually went over the care plans in detail with the CNAs. I mean, how can we do that everywhere? How can we scale and spread that? It's a great best practice. And I'm sure you have thoughts on other ones as well. Other thoughts?
Hi, Alice.
Hey,
I'll just,
Lene.
Hi. I'll just say I'm enjoying, I know it's for sad reasons, but I'm enjoying all of this discussion about how we can assess and implement residents' goals, preferences, and priorities. I would just like to say that some of my work right now is looking at the role of social workers in nursing homes. And I'm not the first person to say that that would be a great idea. I know that. But I'm writing a policy brief right now that is looking at why social workers would be great champions of psychosocial issues of care, which would include the GPP. And in that role, they could work to train these CNAs as to not just knowing what the care plans are, but how to relate and communicate to the resident about their priorities and preferences. So this is some of the work that I've been doing, and I just wanted to throw it in.
I think that's great. And I think that harkens back to what Senator Moore was talking about also, that it's got to get back to the resident. If there's, we've got to close that loop. It can't just be that they're speaking and they don't know if anybody's doing it, doing anything about it or not. So closing the loop. I know that Jeanette Sullivan Martinez is on the call and Liz Stern. Jeanette, I don't know if there's anything you would like to add from your experiences with care plans.
For best practices, one of the things that they have allowed me to do in my nursing home, and for you that don't know me, I've been a long-term resident in a nursing home in Mystic, Connecticut for 15 years now. And I've been president of the resident council here for about 12 or 13, but they allow me to come into orientation. When we have new employees that come into our building, I get to go in, I get to meet them, I get to express what residents want. First and foremost, please knock on our doors before and announce yourself. I mean, it's a basic thought, but you can't believe how many people don't know how to do that. If you move items in a room, please put them back because not everybody has the capability of moving things back around. Leave your area clean and neat. I mean, these are basic things that a lot of people, unless you are told, don't do it. And it is a real frustration for residents. So, I give kudos to my facility that they allow that interaction with the new workers initially when we first come in, because I think it helps sets the precedent that, hey, somebody is paying attention and does want this for the residents, and we need to listen to what the residents have to say. So that's my comment. Residents' voices really do matter, and it's very important that you listen to them. And not all people living in nursing homes. This is another concept that I'm really hoping that we can address, is that not everybody living in nursing homes are on their deathbed. We're very active individuals that want to continue having a voice and continue doing the things that we love to do. We just need support in doing that. And that would be their goal. And they can't know unless you tell them.
Right. That's so well said, Jeanette, as always. And Nancy Stevens chatted in that the new DONs has told people that the words silent and listen have the same letters.
Yes.
And so she's coming in and talking to staff about how to listen, and how important is that? I mean, people take entire college courses on listening. So it's really active listening that's so important. I'll be glad to just see if there's anybody else who has anything to add. I know we have about 10 minutes left, and we'll want to turn it over to Sumeri for some additional, thoughts on logistics and so forth. But this is just a great conversation. We could have this conversation continue for an entire 24 hours. But other thoughts of specific ideas around this work, and you can also tell us if you think we've gone in a direction that isn't necessarily the best direction. Like, these action plans are meant to put out there and get your feedback. So, there may be things we've missed. There may be things you think we should add. So any final thoughts from anybody about this particular action plan? All right, Sumeri, I do not hear anything, so I think we're back to you.
Great, thank you, Alice, and thank you, everyone. This has been such a rich discussion. Thank you all for sharing your thoughts. I know we'll be sharing the recording in the chat with you all after the call, if you need to refer back to any of the discussions that have been happening. A big thank you to Tara, Terry, and Mary Lou for sharing about the action plan today. And another thank you to the committee members who have and are working towards implementing this action plan. Thank you for your leadership in this work. So you may be wondering how you can stay engaged and stay in touch with the coalition. Let me pull up my slides really quickly. There are several ways you can do that. First and foremost, please look at our action plans. We have 8 other action plans highlighting different aspects of ways to improve nursing home quality. And our next, we'll be hosting 8 other coalition conversations featuring each of the 8 action plans. And our next coalition conversation will be taking place next week. We'll be featuring the action plan on designing a targeted nursing home recertification survey. I'll be chatting in the link where you can see the calendar of events so you can register for them. And also help us spread the word about the action plans. Please share the action plans. Do share our press release that we can also share in the chat. And if you have any other ideas or ways to collaborate and to spread the word, please reach out to us at info@movingforwardcoalition.org, which we will chat in. And Alice, if you could help me chat in those items, that would be fantastic.
Which items are those?
So if you could just chat in our website again, so
Yes,
that
okay,
have
will do.
access to our calendar of events and our action plans. And I've chatted in the email as well. And then lastly, we have a newsletter that goes out monthly and a LinkedIn page as well. And if you'd like to stay in the loop about all of these events that are happening and the progress that the coalition is making, please do sign up for our newsletter and follow us on LinkedIn. Lastly, if you happen to live in Pennsylvania or Michigan, we have 2 state-based teams that we have just started to convene and or are developing membership for. And in these teams, we're really thinking of ways we can take these national action plans and have it be an opportunity to collaborate with individuals and organizations at the local level under state leadership. So if you are interested at all and are in Pennsylvania or Michigan, please email us at that email I just chatted in. And I want to close this off by sharing a comment that was shared earlier during the call. I asked everyone, what does it mean for you to address, what does it mean to you to address residents' goals, preferences and priorities? And they had shared, it makes the difference between impersonal and personal care and individualized goals, between suffering through having a life worth living and appropriate patient-centered care and caring. So thank you, Frank, for sharing that comment. And I think it's a perfect way for us to end this call and serve as truly as a reminder that at the end of the day, our work is centered around what matters to residents. Thank you all. Alice, do you have any other words you'd like to share?
I just want to say to Frank that he made my day because he chatted in that he thinks our organization is doing good work, and we love that, and we want to keep getting better. Of course we do, because we're a quality improvement organization, right? But no, thank you all for a great conversation today, and please join some of the other coalition conversations and engage and encourage other people to join. This is about you guys doing this work, and of course our great leaders with Tara, Terry, Mary Lou, and all the others. And thank you to Sumeri. Many thanks for organizing this call brilliantly as always. So thanks everybody. Go out and have a great rest of your Wednesday.
Thank you.
Thank you.